when the listening is made hard by a range of factors that I'll talk about later. It's most difficult to listen when there's lots of talk, say in formal training, in situations where there's background noise, when the person talking and the topic is unfamiliar, and especially over the phone, and when the person is under stress or feeling anxious. In those situations, as well as in everyday situations, people often feel shamed. They often are judged on the basis of their listening on how they talk, and their astute visual observation means that they quickly pick up on those kinds of judgments, feel shamed and angry, and may think that, well, I'm not as smart, or people don't think I'm as smart or as other people. Change is particularly difficult because familiarity is a great support when someone has a listening problem. And when familiarity with people or processes diminishes, then hearing loss becomes more of a handicap in communication. So the recent changes in terms of the intervention and changes of access to money, the changes of service access, is having a greater impact because of the high level of hearing loss in those communities. The changes in terms of the new local government arrangements is going to have a huge impact, particularly for those 60 to 70% of people in the communities with hearing loss, because the change from a community-based local government which people could go and talk to face to a more distant one where there's greater reliance on phone and email and writing is going to have a much bigger impact on those people with hearing loss in those communities. And those kinds of issues have not really been planned for in the changes that are forthcoming. In terms of Aboriginal health and hearing loss, most Aboriginal patients in remote communities are likely to have some degree of hearing loss. And there are poor health outcomes that are known from work in the non-Indigenous community for people who have hearing loss. It contributes to particularly poor outcomes in chronic disease and mental health. In chronic disease, where the message is very much about the treatment, and if people aren't understanding or taking in that message, then the treatment is often ineffective. And health professionals are generally not trained at all in providing services to clients with hearing loss. And it's important to see this is not simply hearing loss alone. It's a whole package and constellation of issues where having hearing loss during early childhood and then some permanent hearing loss in adulthood, that person is likely to have found it hard to learn English. They're likely to have difficulties learning how to read, had more social problems with peers and particularly cross-culturally, so that they experience frustration, anxiety, and respond by avoidance and aggression in many situations. So school would be hard, and there are poor educational outcomes and work difficulties, and all of that constellation of background experience combines with current hearing loss to create difficulties in using health services. And there's limited access in clients with hearing loss, poor compliance, poor attendance, poor chronic disease management, referral problems going to an outside agency who hits all of those buttons of difficulty in terms of unfamiliar people, unfamiliar processes. They're often terrifying situations for people with hearing loss, where their ability to actually take in information in those situations is compromised. And often difficult clients in clinics and health centres have a hearing loss, and the frustration they experience during communication or misunderstanding contributes to them being difficult and aggressive clients. Looking at education, up to 80% of Indigenous students have a history of ear disease and associated hearing loss. And Aboriginal children with hearing loss experience more learning and behavioural difficulties than other children. Work in the 80s that I did showed that 90% of the children with behaviour problems in Indigenous communities had a current hearing loss, and a similar number of children who had learning difficulties identified by teachers also had a hearing loss. But teachers are not effectively trained how to teach classrooms where most students have a hearing loss. Hearing loss is still treated as a special education issue, which is the profile in mainstream schools where a few children have quite severe hearing loss and there are resources and services to cater for them. But in Indigenous schools where the majority of students have hearing loss, teachers are not well equipped in terms of understanding the issues of that, identifying it, or knowing how to cater for those students. And there's work that shows that the students with hearing loss attend school much more regularly, partly because of the social difficulties and learning difficulties that they experience at school. And the acoustics of classrooms is one major issue that compounds the problems of hearing loss, and it's particularly remote classrooms where the acoustics is often very poor. In most remote classrooms, only a minority of Aboriginal students can effectively learn through talk-focused education, and that there's a need to really adapt the educational delivery to actually match the learning abilities of children, which are much more visual and enable them to learn more effectively. On my website there's an article called Smart Kids, Dumb Classrooms, which outlines some of those issues. Also, the demand for one-to-one support or to manage the behavioural problems of students with hearing loss in the classrooms means that the teacher's engagement with students without hearing loss is also affected. So everyone in the classroom is affected when a high proportion of students in that classroom have hearing loss. So the educational opportunities for students without hearing loss are also affected when a high proportion of students in a classroom have hearing loss.